My name is Rob Doughty. I'm a heart failure specialist at Auckland District Health Board, and this video is to introduce the topic of telehealth. This is specifically in relation to patients with heart failure, and what we hope to be able to provide is a perspective on telehealth, both from a health professional point of view, but importantly also from a patient's perspective on their experience with telehealth. Heart failure is an example of a long-term condition. It's a very common condition, and it's the end result of many different forms of cardiovascular disease. In New Zealand, we have between 5,000 and 6,000 patients admitted every year to our hospitals with heart failure, and it's an example of a long-term condition that affects patients over a long period of time and is very costly both for a patient in relation to their overall health, but also costly from a dollar point of view to the health system. Between 1 to 2% of all money spent on healthcare in countries such as New Zealand is spent on heart failure management. So it's a very important condition to be able to manage long term. The aspects of delivering healthcare for patients with heart failure has received a lot of attention over recent years, and particular emphasis has been placed on patients' self-management. The self-management that's important is to allow a patient to be empowered to actually manage their own condition, to be able to take the medications they need to take, to look after themselves, to improve their general health, but also specific aspects of their condition, their specific condition that affects them from a heart failure point of view. A lot of that self-management can be very simple and very straightforward, but needs to be something that a patient is doing from day to day to improve their long-term outlook. Some of those simple aspects include the patient weighing themselves regularly, and that's a very good reflection of the patient's fluid status. So one of the problems for a patient with heart failure is fluid retention. It's retaining extra water, which the patient may then experience as seeing swelling of their ankles, but also becoming increasingly breathless. And one of the problems is that this can happen very quietly and very slowly for a patient, and it's not so easy to pick up. Ultimately, with a lot of fluid retention, then a patient may become very breathless and need to come back to hospital, and the readmissions for patients with heart failure are very common, and again are something that are potentially preventable with long-term self-management. So a lot of emphasis has been placed on healthcare professionals helping patients to actually improve their own management of their own condition. And this is particularly where telehealth has an important role in relation to heart failure management. So the concept of telehealth that you'll see more about in the next few minutes is to actually empower a patient further and help them in their day-to-day management at home, but with some liaison and supervision with healthcare professionals, both in primary care and in secondary care. The concepts that we've been piloting are telehealth in relation to very simple aspects of patient monitoring. That's including patients weighing themselves and also then being able to check their own blood pressure and heart rate. This can be facilitated very easily in the patient's home with a set of scales and a blood pressure monitor. Both of these are widely available, and they specifically for this pilot are Bluetooth enabled, and then the data for the patient's weight and blood pressure can then be transmitted through a cell phone to a secure server, which can then be viewed by the patient themselves, but also by healthcare professionals in a secure environment to actually see the data from day to day. You'll see more about these aspects of patient self-management with telehealth care over the next few minutes, but I think what's particularly important to remember, this is only one aspect of heart failure management. It's only one aspect to help patients and facilitate patients improving their own self-management. I think it's very likely that telehealth will have a component of care for a period of time, maybe a few months, maybe 6 months, maybe 12 months for individual patients. but then to transition and learn from that experience and then transition away from telehealth to be able to continue their own self-management long-term themselves, and then be able to liaise appropriately either with their own general practitioner in primary care or community-based nurses or more specialist care from a hospital aspect. So it's very much about facilitating improvements in their own self-management as opposed to being seen as standalone component. It needs to be integrated across broader aspects of heart failure management. So what you'll see over the next few minutes is more information regarding telehealth, and this specifically relates, as I've mentioned before, to heart failure management, and we hope to be able to provide some perspectives from a patient's perspective who's had some practical experience with telehealth in relation to his heart failure management, but also aspects of information and experience from the heart failure nurse specialists who are integral to the delivery of healthcare for patients with heart failure.